This is Dr. Dean Elbe for MediaPharm, health information with a personal touch. So let's say your family member has received a diagnosis of attention deficit hyperactivity disorder, or ADHD, and despite the best attempts at behavioral therapy and supports being put in place, ADHD symptoms are still bothersome and you're ready to consider treatment. Well, first of all, a word about elimination diets for treatment of ADHD. Diets which eliminate specific foods such as gluten-free and casein-free diets have been touted for treatment of ADHD, but the best studies available using these diets show no benefit on ADHD symptoms. In addition, strictly following these diets can be costly, time-consuming, hard to stick to, and if used in place of proven medications, can delay the start of effective treatment. As for the medications themselves, stimulant medications have been used for treatment of ADHD for more than 70 years and are some of the most effective and best studied medicines available. Remarkably, 4 out of 5 patients with ADHD will improve when treated with one of the 2 main classes of stimulant medications. For those whose stimulant treatment does not work, alternative non-stimulant medications are also safe and effective for treatment of ADHD. While it seems strange to give a stimulant to someone who seems quite overstimulated already, consider this. The next time you're in line for your daily espresso triple shot extra foam non-fat latte, and let's be clear, coffee is a type of stimulant, take a look around the coffee shop at what people who are consuming the stimulant are doing. Most are reading the newspaper, having a conversation with friends, or working intently on their computers. Stimulants actually help increase and improve focus for most people. Stimulant medications are very effective, but they're not perfect. Side effects may occur, though for most patients these are usually not too bothersome. Parents are often concerned about stimulant effects on children's appetite and growth. In the biggest and longest study to date, children who received stimulant medications for 3 years ended up being on average 1 inch shorter and 6 pounds lighter than children with ADHD managed by behavior therapy alone. A good way to look at this issue is, would you rather your child was able to focus enough to be much more likely to graduate from high school but be 1 inch shorter than expected, or forego stimulant treatment, grow to their expected height, but be much more likely to drop out of school before graduation? Stimulant medications have an established track record of safety. While there have been a very small number of reports of sudden death in patients treated with stimulant medications over the years, this has to be contrasted to the millions of prescriptions written each year for stimulants. In most of these cases, patients had pre-existing heart conditions or an excessive amount of medication was taken. Before prescribing a stimulant medication, doctors now ask about a family history of heart disease and consider measuring heart rhythm with a simple, painless electrocardiogram. New long-acting once-daily forms of stimulant medications give control of symptoms throughout the day and evening time, increase convenience, and help preserve confidentiality. Patients are more likely to stick with the treatment. Unfortunately, depending on where you live and what health insurance you have, long-acting stimulant medications may or may not be covered. So it is best to talk with your doctor or pharmacist about how medications will be paid for before any prescription is written. A good rule of thumb for seeking treatment for ADHD or virtually any psychiatric condition is this: if symptoms are significantly affecting you or your child's life, whether at work or at school, with family and friends, or the ability to participate in leisure or after-school activities, you should consider talking with your doctor. If you suspect your child, partner, or even you yourself have ADHD, you need to know that there is effective help available. Visit some of the websites listed for more information and consider making an appointment with your doctor to talk about ADHD and available treatments. For patients with ADHD who receive effective treatment, the difference can be like night and day. This has been Dr. Dean Elbe for MediaPharm, health information with a personal touch.